Yes, leprosy can be cured. The World Health Organization, WHO, recommends a regimen of multiple antibiotics to treat the disease. This treatment regimen is very effective, and recovery from leprosy is often complete. For leprosy usually consists of 3 antibiotics taken together for 1 year or more. The antibiotics that are commonly prescribed include rifampicin, clofazimine, and dapsone, although other antibiotics may also be used to treat the disease. Early detection and treatment of leprosy is essential for successful cure, as the disease may become more severe over time if left untreated. Symptoms of leprosy can include skin discoloration, loss of sensation, and numbness in the limbs. Without prompt treatment, leprosy can cause permanent damage to the body, including disfigurement and deformity of hands, feet, arms, and legs. Disability that is caused by leprosy can be prevented if the disease is identified and treated in its early stages. Leprosy is not a highly contagious disease and can only be spread by close and prolonged contact with the saliva, fluids, and sneezes of a person with active leprosy. In addition, it can also be spread through contact with contaminated bedding or clothing. Diagnosis of leprosy is based on clinical suspicion and also the presence of certain markers in the skin. Treatment usually involves a combination of drugs, and the disease can be cured with close monitoring and regular health checks. Leprosy can have a devastating effect on those affected, causing lasting physical and psychological damage. The bacteria that causes leprosy can also be resistant to the antibiotics used to treat the disease, making treatment difficult. In order to help prevent the spread of leprosy, people with the condition should be given protective clothing, such as gloves and masks, and contact with the patient should be minimized. Also, family members and other close contacts of a person with a disease should be tested regularly for the infection. Prevention and control of the disease can be achieved through early diagnosis, prompt treatment, and improved living conditions. Health education campaigns should be implemented to reduce the stigma associated with the disease, and access to medical care should be improved. The complications of leprosy, including disability and disfigurement, can often lead to social exclusion and rejection. People who are affected by leprosy should be given emotional and social support throughout their treatment and recovery. While leprosy can be cured if it is detected and treated in its early stages, the combined stigma and fear of the disease can lead to people avoiding diagnosis and treatment, allowing the disease to spread. It is essential that healthcare providers are adequately trained to provide leprosy services to ensure that patients feel safe and supported, including psychological support. Also, care should be provided in a non-discriminatory manner. Without access to appropriate care, people with leprosy are often denied their rights as citizens, including access to education and employment opportunities. Therefore, programs and initiatives should be implemented to ensure the rights of people affected by leprosy are respected and protected. In addition to providing medical treatment to those affected by the disease, there is a need to address the long-term consequences of leprosy, such as disability and disfigurement. This should include financial and psychological support for those affected. Improved access to early diagnosis and treatment is essential to reduce the spread of the disease, as well as to enable a successful cure. There is also a need to ensure that preventive measures, such as wearing gloves and masks, are taken to reduce the risk of infection. Leprosy is one of the oldest known diseases, and one that has been linked to stigma and fear for many years. However, with improved medical care, early diagnosis, and timely treatment, the condition can be successfully cured. Curing leprosy requires the regular and vigilant use of antibiotics, as well as a strong commitment to follow-up care. If left untreated, leprosy can cause lasting disabilities and disfigurement. Therefore, early diagnosis and prompt treatment are essential for a successful cure. The overall success of leprosy treatment depends on the right combination of antibiotics, as well as appropriate monitoring and medical guidance. Without this, the risk of complications and the spread of the disease increase. The development of newer and more effective antibiotics, as well as more efficient diagnostic tools, have helped to improve the cure rate for leprosy. However, stigma and fear of the disease may still lead to some people avoiding diagnosis and treatment. WHO has launched a global initiative to eliminate leprosy by 2030. To do this, efforts are needed to improve access to diagnosis, treatment, and supportive care, as well as to reduce discrimination towards people affected by the disease. A key goal of leprosy control is to reduce the incidence of deformities and permanent disability caused by the disease. Effective treatment of the disease, combined with social and psychological support, is essential to achieve this goal. The burden of leprosy falls primarily on poorer communities, as access to medical care is limited. In addition, education is needed to reduce stigma and fear of the disease, and to ensure that people affected by the condition are provided with the necessary support and care. In many cases, leprosy can effectively be cured with the right combination of antibiotics and supportive care. However, the social and psychological impacts of the disease can be profound, and should not be overlooked. Additionally, in some cases, even with effective treatment, deformities may persist. Therefore, the availability of reconstructive surgery and rehabilitation is important for those affected by the condition. In conclusion, leprosy is a devastating and potentially disfiguring, but ultimately curable, illness. With proper treatment and supportive care, most patients can make a full recovery. Furthermore, preventive measures should be taken to reduce the spread of the disease.